Hi, good morning. My name is Daynelis Sanchez. I'm an RT student from Miami-Dade College Medical Campus. Today I'll be making a video on how to perform trach care. Trach care is indicated for all patients with a tracheostomy tube in order to maintain the skin integrity and to avoid infections. There are no contraindications for trach care, but there are possible hazards and complications such as atelectasis, bleeding, tachycardia, hypoxemia, and respiratory distress. As any other procedure, we're first going to verify the physician's order to make sure that the patient needs trach care. Then we're going to go ahead and knock on the door, come into the room, introduce ourselves to the patients as an RT student, and explain the nature of our visit. Then we're going to go ahead and perform hand hygiene for at least 15 seconds and don the non-sterile gloves. Now I'm going to go ahead and check that this is the right patient by using two patient identifiers, the name and the medical record. And I'm going to go ahead and gather the necessary equipment. For this video, I'm going to need a trach care kit, a BVM, and a suctioning source in case we need to suction the patient. Now I will position the patient in semi-follows position and assess the vital signs: heart rate, respiratory rate, SpO2, and breath sounds. If I hear coarse crackles, I will suction the patient before the procedure, hyperoxygenating him before and after suctioning for at least 30 seconds. I'm now going to go ahead and open up my trach care kit using aseptic technique. The first thing that we're going to find is the sterile field. I'm going to open it and make sure that the side I'm touching is the side I'm placing on the bottom, making sure that everything on top stays sterile. Now I'm gonna go ahead and carefully dump everything that I have on my sterile field on my trach care kit onto my sterile field. Like so. Here we have sterile water, hydrogen peroxide, and some more hydrogen peroxide. I'm gonna go ahead and mix the sterile water and the hydrogen peroxide on this container, and then just sterile water on the other two. Inside the kit we also have 4x4 gauzes, a pre-cut 4x4 gauze, a brush, Q-tips, a tracheostomy tie, and the sterile gloves, which I'm gonna go ahead and put on at this time. Now we're going to go from the inside on this one. Like so. If we need to throw this paper away, just make sure to grab it from the inside, since it's the part that is still sterile, and throw it away. Okay, now we're ready to begin. First, we're going to remove this dirty pre-cut 4x4 gauze. Remove the inner cannula and let it sit on the mixture of hydrogen peroxide and sterile water for at least 15 seconds. After, we're gonna grab the brush and we're gonna go ahead and brush the inside, the outside, making sure that we get rid of all the mucus that gets stuck in here. We're gonna dip it again into the mixture, We're gonna rinse it once, twice, tap it, and set it aside just to air dry. Now we're gonna clean around the stomach side and the outside of the tracheostomy tube. We're gonna grab a 4x4 gauze. We're gonna dip it into the hydrogen peroxide and stir water mixture. We're gonna go ahead and gently clean the surroundings of the stomach area and the outside of the tracheostomy tube. For the hard to reach areas, we're gonna go ahead and grab a Q-tip, dip it into the mixture, and we can go ahead and clean the hard to get mucus or gunk. Okay, always make sure that we rinse it off. We need to rinse the hydrogen peroxide, because if we leave it in the patient, it can cause the skin to get irritated and itchy. So we did the gauze into the just stir water, and now we're rinsing off any excess of hydrogen peroxide. We're gonna go ahead, replace the 4x4 gauze, the pre-cut 4x4 gauze, with a clean one, just to keep everything nice and dry on the patient. And this would also avoid skin irritation. Okay, now we're gonna go ahead and change the tracheostomy ties with clean and new ones. We're gonna remove one side first, always holding on to the flange. We're gonna go ahead and remove the other side. And secure it. And we can go ahead and readjust the gauze if we need to. Okay, now that the patient is almost ready, we can go ahead and reinsert the inner cannula and lock it in place. And I'm gonna go ahead and reassess the patient's vital signs, heart rate, respiratory rate, SpO2, breath sounds, and I'm gonna make sure that we have airway patency. Before we exit the room, we're gonna ensure that the patient is comfortable. If there's nothing else that we can do for him, I'm gonna go ahead, remove my sterile gloves, dispose of all contaminated materials, remove the non-sterile gloves, perform hand hygiene for at least 15 seconds, and document the information or the procedure on the patient's chart. This has been a how to do video on trach care. I'm Daynelis Sanchez, and I thank you for watching. Bye.